Jackson. I am a public health researcher, scientist, and consultant that works in the maternal health space and also in the birth equity space as well. My career has kind of been supporting startups and how they engage with their customer, but also I'm also trained as a full spectrum doula, and most of my work centers and cares about Black birthing people and how we can improve outcomes, especially here within the US. I have my bachelor's is in biology and global health, where I focus most of my research on reproductive health outcomes and equity, especially within the Black community. And then I also went on to get my MPH in health systems and public health economy, once again focusing on the Black maternal health crisis. My work has been in the US, so when I refer to Black maternal health, I'm referring to a concern for the most vulnerable and a movement that centers pregnant and birthing people at kind of the intersection of crisis. If we look in the US, we see Black birthing people dying 3 to 4 times their white counterparts, regardless of income, regardless of education. And these are things that if we look in the history of public health, that's kind of unprecedented. A lot of times in public health, when we're looking for solutions, we throw money at it and we throw, if we get people educated, that's going to fix it. And Black maternal health is a pretty complex issue where that is not the solution. And so for me, that helps me define that Black maternal health really is a movement that centers the most vulnerable, like I mentioned before, and also is something that is incredibly multidisciplinary. It addresses class, it addresses environmental justice, it addresses food access, water access, resources. When I say money can't be thrown at it, I'm more thinking about those simple, sometimes like money grant transactions where, say you're looking to improve something in a community and you say, okay, we're going to give each individual a $1,000 grant. I think when I think about solutions, they have to come from each level. So it wouldn't just be, okay, we give birthing people a $1,000 grant so that way they can maybe choose care. It's connecting them with resources for doulas, connecting them with birthing centers, connecting them with classes that might help them reach out to other birthing people of color. I think connecting people with lactation specialists, and even that's just some of the things that I think can happen at a community level. When I think about larger solutions, I'm thinking about improving culturally competent doctors, increasing the number of Black physicians and Black OBGYNs that we see in the community. When I also think about restructuring our communities and ways that support families. I think you can look at it from many different angles. So when I mean you can't just throw money at it, you really can't just say, oh, this amount of money is going to fix it. You have to start looking at policy. You have to look at how communities are built, how people are talking and giving birth, and then start addressing needs there. As you can tell, I'm Black. So I really do care about not just my own health, but my community's health. And when I was in undergrad, and I was always interested in women's health and outcomes and reproductive health and contraceptive health, that type of space. But it wasn't until my final year that I started to read papers that were talking about, okay, Black birth outcomes are poor regardless of kind of what I spoke about earlier, regardless of education, regardless of socioeconomic status. And for me, there was at that time, this was 2020, there was relatively no papers out at that time. And so I thought there was kind of a deep academic range that was left to be. I mean, I know that you could see anecdotally that doulas were helpful in the birth space, but there were no papers to kind of back that. And so I saw a lot to be done in the academic sphere, because when there's a paper, you can get some funding, or back before this election, you could get funding for it. But now, I think that's what kind of sparked my interest, just from like scientific inquiry, it being about my community. And then as I started making steps in my career by first being a doula and then going and getting my MPH, I saw how this work can really shape the health of the Black community, because if we can support people from conception all the way through to adulthood, I really do think it's a beautiful work, and I think it's a work that doesn't just heal ourselves, it heals our community, and I also believe it can heal the planet. If we look at the father of gynecology and the history of gynecology as a practice, it was initially done on or performed on enslaved people. And so the science as a whole already has a very treacherous and evil past. And this was done on enslaved people who, without anesthesia, without the proper support. And at the time, and this has continued in medical education, there is a perception, a difference in pain perception that not until very recently has started to stop being taught in medical education, that, Black people actually don't feel, it's not that we don't feel pain the same as other races. And I think that is just one example that shows you how deep medical racism begins. The foundation was racist in the US. A lot of the tools that we use in gynecology and obstetrics were tools that started in slavery times and have continued to today. And I think there needs to be more education about that, and a recognition that there's a lot of blood on the tools of obstetrics, and how can we move forward from that. So in my own work as a doula, I definitely have been in hospital rooms and kind of seen a dismissal of Black pain, a dismissal of concerns. I've also worked with the Haitian immigrant population. I was in San Diego and I was working with the Haitian immigrant population there, and I was exposed to threats of deportation if certain medical procedures weren't followed. And it was kind of this very real and present threat. And I think a lot of times, I guess for people who aren't experiencing racism on a daily life or experiencing that type of threat, I think it's easy to think that it's not here, or it's something that might have happened in the past, but we still see people of color dying just due to racism, or just due to not believing pain and all of that. So it's very real. It's still here today. I think from a public health perspective, when we look at birth rates, when we look at birth outcomes, they really do come down to where you are in the US, how close you might be to a hospital, how close you might be to care, the number of physicians in your area. Those are kind of base level. I think many people could kind of see how that would matter. But on the flip side, it's also access to food, stress exposures. We see a difference in urban environments versus rural for many different reasons. And in the role I am now, I work with a supplement company called Needed that works to advance nutrition and fertility outcomes for women in the US. And it's been interesting to see their work because they also talk largely about toxin exposure and how that can have impacts on fertility, birth outcomes, and postpartum recovery. And I think that's been a newer aspect of the work and a kind of interest level that I've been at, but I think that directly ties to environmental justice and how we kind of move forward and build outcomes. I think the US is actually becoming more and more anti-intellectual. And I think that is a threat to women's health, and birth equity, perinatal health, and postpartum academics as well. And so I'm actually really worried about funding and how a lot of these fields are still severely understudied, and that's not even considering just Black maternal health or just Black outcomes. I think women's health and birth health at large is severely understudied. So I'm actually really worried about funding and kind of care about the academic backing of this. I'm also really worried about health insurance structures and how they're going to impact how we kind of move forward with within birth, fertility care, and postpartum care. because we know, especially in the US, we know insurance companies have a hand in how our care is delivered and what's offered to us. So in the past 5 years, we've seen, for example, we've seen doulas become more accepted by some insurance plans across the country. But I'm interested to see how, given the current political climate, what will be covered and what won't be covered, what type of care will continue to be valued. And I think it's going to hurt Black people the most. It's going to hurt it's going to hurt people who are the most vulnerable. This is almost tired to say, but I think voting in the interest of science and the interest of science and the interest of care is the first thing that I think anyone over 18 who can vote can do. I also think educating yourself, like getting your hands on as many different types of novels and academic papers, or reading as much as you can to prepare. If somebody is considering conceiving or is already pregnant and considering like kind of how to move forward, just reading as much as you can about the medical system and how to prepare yourself. I also, if it's within your means, to get other people alongside you on that journey, just to learn more about the process, because I do think, speaking as a doula, knowing a little bit about the birth space can go so far for outcomes. And I think too, we're seeing a lot of community resources kind of coming up to support fertility, conception, and postpartum. So I think those are very light. I don't want to say light, but those are some things that to get started as well. I think my initial instinct is to lean on the experts. I think a lot of times to lean on or seek out experts. I know when I'm practicing as a doula, I know I don't know everything about what's about to happen. And so I lean very heavily on physicians in the space that I'm working with and the nurses in the space that I'm working with other birthing folks, people who've gone through it. And so I think I would kind of encourage that in the medical community. Reaching out to environmental health specialists should be a part of our healthcare system. And I know it's a big ask, but I think it's something that is worth exploring, from large hospital systems all the way down to community providers, just considering how can we reach out to people who already have answers, because I think there are some high-level environmental justice concerns, but also they also boil down to specific communities. And so I think it's worth reaching out to maybe local universities or local environmental, like I mentioned before, local environmental health specialists, and asking them, okay, what's your consideration? What should we be thinking about when we build this hospital here? What should we be considering when this person comes from this neighborhood? Or what type of tests should we be running for toxin exposure based on where people are coming from and where they're living? I think that would greatly enrich the medical services that we receive and the medical care that is given in our communities.